Hi, my name's Pip. I'm one of the physios at Sydney Advanced Physiotherapy in Lynfield, and welcome to our Sunday Sessions series of videos. In these videos, we hope to help you understand a little bit more about your body and to answer the questions that we often get when we're in the clinic. Today I'm going to be talking a little bit about lymphedema. So lymphedema is really common after you've had a lymph node dissection. So for example, I had my lymph nodes removed as part of thyroid surgery. It happens as part of gynecological surgeries, often for cancers. It's a common part of breast cancer surgeries, but lymphedema is something that you can see in people who haven't had any lymph node removal. It can be something you can see if the lymphatic system is overworked and overcongested and somebody needs actually some help with that. It can be something you see in people who have a lot of illness or who've been, for example, we see it really commonly, very tight in the neck and the shoulders for a long time. You can see some fluid build up in that area. So lymphedema is basically the accumulation of waste products from the day that your lymphatic system would normally clear out and pass through your body, and eventually you would excrete it. So you would pee it out. So often when we see lymphedema, we really commonly see it in the arms. So often what people say is they started to feel that their arm felt a different weight to the other one, or it just started to feel a bit bigger, but when they felt it, it felt kind of the same. So it can be really important, for example, if you've had breast cancer, that you have measurements done of your arm so you know if it's changing, so you know if fluid is accumulating in your arm. The same thing often with when people have had pelvic surgeries or gynecological surgeries, usually for a cancer diagnosis. They tend to say that the legs started to feel a little bit heavier, or they noticed that their pants were a little bit tighter on one leg than the other leg. And it's really important that you go and see someone as soon as possible when you start to notice these symptoms. In an ideal world, if you know that you're at risk of lymphedema because you've had a cancer diagnosis and subsequent surgeries, it's a really great idea to proactively manage this issue. I know that I get lymphedema in my face because I had 5/6 of my lymph nodes removed on the left and a couple removed on the right. Particularly when I get like tonsillitis, my face just goes and explodes because my body's just not able to drain out everything that's accumulating because there's so few lymph nodes left. And because there are so few lymph nodes left, it is something that I try to periodically manage. So I have a lymphatic drainage massage to actually clear that out and allow the fluid to pass out. You might have also seen, if you follow us on Instagram, for example, me with tape on my face. Obviously, I choose my times for when I'm going to have tape on my face, or it is when I really need it. And I find that that tape is so effective at draining my face. It's just incredible. I only usually need to keep it on for a couple of hours, and it's already made a substantial difference to how poofy my cheeks are and how much fluid is accumulated. When things are really bad and I have, like, for example, again, tonsillitis, I have one lymph node that blows up like a golf ball, and it's excruciating when that happens, and that's usually far worse than the tonsillitis. And I put the tape on then, and I have it just draining and helping that lymph node drain my face and my throat area the entire time I'm sick, and I find that I get better so much faster and I'm so much less uncomfortable. So with lymphedema, really I wholeheartedly recommend a proactive stance on that and actively seeking treatment before it's an issue. The other reason I am very pro you seeking treatment for lymphedema before it's an issue is because it's also great to have someone who is tuned into your body, who knows what your body feels like, so that they can help you detect changes. Now, what I would say at this point is that we at Sydney Advanced Physio do not fit the lymphedema garments. You would be best to talk to your treating doctor to find out where they do that near you. But we do loads of other things that can help you with lymphedema. So one of the major things we do is a lot of breathing re-education. So often when there's pain or emotional trauma, the way you breathe changes. So instead of getting a really nice expansion down in your lower rib cage, people tend to start using their neck muscles or their shoulder muscles or their chest muscles, or kind of a combination, and they do a much more shallow breath, and you see a lot more neck and shoulder tension when they're breathing. Now, breathing is actually a super important part of pumping fluid out of your body. It's an important part of the pressure balance within your body. So you've got your thoracic cavity, so your rib cage region, you've got your abdominal cavities, your stomach region, and you've got your pelvic cavity, so everything that's inside your pelvis. And you need to have a nice balance in the pressures in those cavities to not have prolapses, to not have a belly that won't go away, to pump out waste products of the day, you need to have your balance right. Keeping these pressure balances in check actually helps minimize congestion. And if you can minimize congestion, it does help hugely with lymphedema. Working on your rib cage alignment and the stiffness in your middle back is a huge part of preventing lymphedema, particularly for people who've had like neck dissection or armpit dissection of lymph nodes when they've had a breast cancer diagnosis. It is not just about the effect of the surgery and radiotherapy and things like that that can affect your rib cage mechanics. Now, working on the rib cage alignment is something that could have been off from long before any surgeries or treatment that you may have had. And this is something, again, that we see in the general population who have had no diagnosis of anything and no surgeries, nothing. If your ribcage alignment is off because your posture is terrible, or because you carry babies just on one side, or because you have terrible bags, could be off for any number of reasons. That affects the pressures in the cavity, so it really affects the thoracic cavity. It affects your diaphragm hugely. It affects your body's ability to pump fluid out of your body. And also that fluid that's being pumped out of your body and being drained out of your body, it's got to go somewhere. And what we find is that if you're getting stiff in your mid-back, and that often happens when your alignment in your rib cage is not great, if you're getting stiff through there, then the fluid tends to kind of get stuck and not be able to get out and drain. So it's really important that you keep your back nice and flexible and well aligned to optimize your body's ability to drain any waste products or any fluid throughout the day, and also to reduce the extra strain on your body that comes from being stiff and being tight and being poorly aligned. That being said, it's really important that you know that if I was to have treatment for breast cancer and I was to have radiotherapy to the breast, then that tissue that was affected by that, it changes for years afterwards, so that you don't need to just be vigilant for 2-3 months after treatment. You need to keep an eye on how your body feels for a good 7 years afterwards. And usually when I tell breast cancer patients that, for example, they usually don't like that information very much, and I totally understand. But that doesn't mean you have to seek active treatment for 7 years. It just means you need to learn to feel what your body feels like when it feels good. And if you start to feel something tighten up, if something's changing, you go and seek help straight away. You don't let that snowball. But the reason I tell people this is not to scare them, although I know that it does, but I can't in good conscience not tell them, because a lot of the cases of lymphedema that I see and treat have actually come up further down the track. And they've come up because people's bodies have changed, the scar tissues have tightened, the radio tissue has changed, and your body has changed, and so you get this buildup of congestion. So it's important that you understand that it's not something that you only need to worry about for 2 years afterwards. I started noticing the puffiness in my cheeks probably like 3 years later. I can't remember now because it's been nearly 10 years since I was diagnosed. But it's something that you need to be aware of and be in tune with your own body. So the other thing that we do is we help release some of the tight tissue that might be restricting the flow of fluid. We see this really commonly in the legs and also in the arms. My arm is handier, so I'm going to show you on my arm. So you can come through and you can feel where there are areas of restriction in the tissue, and we actually come through and we release that so that there aren't areas where the fluid is pooling and accumulating, and then it slowly becomes more and more and more, and then you find that you've got lymphedema. So one of the management strategies is to make sure that there are no tissue restrictions. The other thing we do is kinesio tape. So as I've mentioned, I have it on my face periodically to drain it out, and I find it extremely effective. I've also used it when I fell down in between the gap in between a bus and a platform and got huge hematoma bruises on my legs. I find it is extremely effective with helping filter out fluid and bruises, so acute ankle sprains. I use it all the time. But obviously tape is not for everybody. Everybody's skin has different sensitivities. I have very sensitive skin, so I can really wear it for a couple of days at best, and the kinesio tape, the brand that we use, is about as good as it gets in terms of a hypoallergenic tape. Like, I am no good with micropore or standard sports tape, can only wear them for an hour at best, and then I get blisters. So obviously that's a consideration whether that's appropriate for you. Some people prefer the tape because the pressure garments for lymphedema can be extremely warm, particularly in summer. So I have had patients who, with consultation with their doctor, actually choose to wear the tape in summer instead of the pressure garment, or who just prefer the tape generally, and I teach them to self-tape, and they just replace it to help drain the body out. And sometimes I find taping can be a nice thing to use before getting fitted for your pressure garment. So sometimes it actually flushes out a lot of fluid, so that then you can have the pressure garment fitted on a less swollen arm, for example. And then I find that the pressure garments are more effective. The other service we offer to help people with lymphedema, which is something that you'll find at many locations, is lymphatic drainage or oncology massage. So it's a very relaxing, very gentle type of massage. And patients are often surprised by how gentle it is, but it has to be gentle to move the fluid. Otherwise, you're pushing through the fluid and you're into the muscle. And the massage therapists who are trained in either lymphatic drainage or oncology massage actually are very talented at pushing fluid out. And I've had varying experiences with this. So I've had it where, you stand up afterwards and it feels pretty much the same, and an hour later it's like the fluid just drops and moves through my body straight away. Sometimes it just needs a little bit of time to drain after it's been moved. I've had it where I feel it straight away when I stand up off the bed that it's drained. And again, I think this is a really important type of massage, not just if you're an oncology patient. I had this quite a lot after getting off planes. So recently I nearly missed my plane flight home from America, and I had to drive across Nevada in the middle of the night, so I didn't miss my flight. So I was sitting down for basically 2 days. By the time I got off the plane, I didn't have ankles. I basically just had calves that were continuous right down to my foot. So I had a few lymphatic drainage massages to try and push that out. I have also used it as part of treatment for the hematomas after I fell down the gap in the bus in Africa and my legs were swollen and bruised. So it's a really important part of therapy. I have referred patients who are chronic back pain, chronic neck pain patients for lymphatic drainage because they have accumulation of fluid in their neck and in their arm just from being so tight and so stiff. So it is really a very, very important thing to be aware that is out there. Make sure your massage therapist is trained in either lymphatic drainage or oncology massage, and that you state that that is what you would like to have when you are looking online for someone in your area who does that. Our massage therapists absolutely do it, and they work alongside the physios. So very frequently, for example, I will ask the massage therapists to do something specific that will complement what I'm doing as part of their treatment. So some bodies need you to be far more specific, and so it's a really nice way to get treated when you can have the massage and the physio working together to try and help you achieve the same goal. and it also just helps you get a much better result from the massage. So I hope you found this video useful, and if you have, please don't forget to like it or share it so that other people will see it. If you have any other topics you would like us to cover as part of the Sunday sessions, then please feel free to let us know. If you need any help at all with your body, please check us out on sydneyadvancedphysio.com.au, or you can call us 9416 4410.